Good evening, Dr. Sayon and everyone. This is Dominic De Los Reyes. I'm the program coordinator for the Community Health Worker Communication and Outreach Services, a program of UPAC, the Union of Pan Asian Communities. And this is one of two of our regular community engagement sessions where we share information on COVID-19, local updates, resources, and just have a discussion about things, especially as they pertain to our communities most impacted by the pandemic, like, Native Hawaiian, Pacific Islander, Asian, right? So this is a space where we can ask questions, engage in dialogue, and really talk through some of the difficult things we're navigating because the pandemic affects us all as a community, and we can get out of the pandemic together as a community as well. So I am really excited about tonight. We have the local expert on COVID, Dr. Sayon. He is a board certified preventative medicine physician who aims to work on the population level to address health related issues and continuing his work to protect and promote the health of all San Diegans as the former Deputy Public Health Officer for the County of San Diego's Health and Human Services, Public Health Services. He currently serves as a medical consultant for the county, and he has a strong interest in health equity and is mission driven to improve the quality of life for all San Diegans via the Live Well San Diego vision. In addition to population based efforts, Dr. Sayon sees patients in the county's public health clinics and continues to be an associate reviewer for the American Journal of Health Promotion. He was born in Nigeria to Sri Lankan parents and raised in Toronto and Buffalo, New York. So you got a vast experience of living different places, knowing different people. Also received his Bachelor of Science in Biology from Purdue in Indiana, medical degree from New York University School of Medicine, and Master's in Public Health. Wow. So thank you and welcome, Dr. Sayon. We also wanted to let folks know we try to make this an accessible event. So tonight we also have two American Sign Language interpreters. Thank you, Leah Brown and Lori Bellama. I also want to bring your attention, especially to those who are logged into Zoom. You can turn on the closed caption option on the bottom of your screen to read along if you like. And we are also streaming on Facebook, on the UPAC Facebook page. So feel free to type any questions in the comments there, as well as you can use the Q&A box if you're logged into the Zoom, or just type right into the chat. So thank you so much. We also have potential assistance in Tagalog with our community health worker, Jeanette. And okay, I think that's enough introduction. Thank you, Dr. Sayon. Feel free to take it away and screen share if you like.
Thank you so much, Dominic, and thank you everyone really involved in allowing me to just have a dialogue with you, really come, and especially at an evening hour. I know many of you have family time, etc., and appreciate you taking the time, because learning about COVID really is another way to care for your family and your extended family and your community. So we really appreciate it. And since you mentioned it, Dominic, I'm not sharing the data on in terms of the rate of infections, but when you look at the Native Hawaiian or Pacific Islander group as a group, and when you look at the case rate, not the number of infections, when you standardize it in a way that you can compare it with other racial ethnic groups, there's actually have the many of you all really in your community has the highest case rate that we see in any groups across. I mean, by numbers wise, we know the Latinx population is definitely the most affected. But when you look at it in a rate basis and compare, then really you all are there, and unfortunately the most affected. And of course, those numbers vary over time as well. Okay, so I'm really here to talk about kind of the vaccines. Thank you for that kind intro. And give you a primer on vaccines and just start that dialogue. I know there's a lot of questions on vaccines, and I'm happy to support and answer whatever questions that you all have. Okay, so this information, we do have a kind of a slide set that we update routinely. This is accurate as of a couple days ago. These are some words, just kind of context. You know, we're talking about vaccines. What is a vaccine? I'm just going into this in case you're hearing vaccine. What does that mean? It is something that really works and prepares your body to fight the disease, that potential disease that you may get exposed to. If you get exposed to it, you would be able to fight it faster and more effectively because of these antibodies that you produce after this vaccine. Vaccination is the act of getting the vaccine, and immunization is the process of becoming immune or protected against the disease. So let's start about myths and talk about why to get the vaccine, right? So just to start and address many myths, these are many of the things that hopefully you're not hearing as much, but I do know that this is, around, and people are hearing some of this in terms of kind of things that are just not facts about COVID-19. And of course, our purpose is really just to convey the facts so that when it's your turn, you could make the most informed decision as to whether or not you will accept and take a vaccine, right? So one myth is that the vaccines will give you COVID. It will not give you COVID. Just scientifically speaking, it's not even possible. The current vaccines that are authorized for emergency use, both of them, they give what's called a messenger RNA into your body, and that is essentially a set of instructions that is used to make proteins, and that's it. It does not have any live virus. It doesn't even have a weakened virus inside these vaccines. And then the second one is that it'll cause you to test positive on a COVID viral test, and that's also just not possible for the same reasons, right? Because it doesn't actually give you COVID-19, so you can't get positive. I have heard of a few cases where people get the vaccine and a few days later they get COVID symptoms, and then they test positive, and that is statistically that's going to happen because the amount of COVID in our environment. Some people may have been exposed before or around the time they got the vaccine and then get the disease later, right? It does take about 2 weeks for each dose to work in your body. Okay. The third one, people have gotten sick with COVID-19 will not benefit from getting vaccinated, and that's also not true. The reason is because even if you had COVID-19, you definitely have some immunity, but that level of immunity may vary by the extent of COVID disease that you had and other factors. So not everyone has the same level of immunity, and we don't know how long that immunity lasts. So the CDC says you can choose to delay your vaccine and wait a few months, but you still should get vaccinated if you had COVID. And so the fourth one, getting vaccinated will not help you prevent you from getting sick from COVID. And the opposite is true in this case as well. So vaccines are the best way to protect you from getting sick with COVID. They are very effective at getting sick with COVID. The two that are out there right now are 95% effective of preventing someone from getting ill with COVID. And even if you do get COVID, for that 5% or 6% that's left over, right, they'll very, very likely have a less severe version of COVID-19 because their body's already on top of it and attacking the COVID virus. Okay, and then the second to the last one, receiving an mRNA vaccine will alter your DNA, and that is also not true, and that's a myth because it doesn't even go into the part of the cell where your DNA is, which is called the nucleus. If any of you took biology or remember the biology classes you took when in school. So then the last one is the COVID vaccines have received emergency use authorization contain live viruses that cause COVID-19. And I mentioned earlier that they do not contain live viruses. So let's talk about the why getting vaccinated, right? And oops. looks like I'm missing a slide. Oh, I'm sorry. Okay, so one is that this is one tool amongst many, right, in our kind of public health armament, if you will, of tools, right? And this is the best tool that we have. We know already we want to layer this on top of all of the existing tools and interventions we have to have the best outcomes possible and reduce the amount of COVID in our neighborhoods, in our communities, in our country, really, and help us get back to normal. And the reason we really want to get vaccinated and we want to get as many people vaccinated as we can is to help us as a region get back to normal, right? And we know that millions of lives, unfortunately, around the world have been affected by COVID. And we know that in the US, even since January, for example, we've already had over 100,000 deaths just in this calendar year in the US. And we know this is the most effective intervention we have. This is the safest way to build immunity or protect yourself from COVID. And this is going to help you get sick from COVID-19. And vaccines work. I'll give you a great example. Many of you may remember just a few years ago in our region, we had a hepatitis A outbreak that got a lot of attention, even though some of the earlier cases were in San Diego and some other parts of California. It did spread across the country. And you don't hear about that anymore, right? That was just a couple years ago. And that's because we vaccinated our way out of that epidemic. Right. So that was a very safe and effective vaccine. We were able to get into enough people to build what's called herd immunity or community immunity, like I like to say. So I just want to talk about the development of the vaccines and the safety efforts that are and processes that are in place and that were put into place in addition to the usual ones. So when we talk about the two currently authorized vaccines, they're authorized for emergency use by the FDA, the Food and Drug Administration, they both use the same type of technology. And that's part of why we see these vaccines first in line, so to speak, because it's easier to mass produce and come to fruition, if you will. And so the main things is they have what's called a messenger RNA. And RNA is a single strand, single-stranded RNA, sorry, and it's very unstable by itself. So what that means by unstable is that you have to put it into something, you have to put it around kind of a fatty layer of cholesterol, fatty molecules or lipids like you see there, and then add, of course, salts and sugars to make it stable. And because it's relatively much less stable than DNA, which is double-stranded, you actually have to also keep it at freezing temperature until you're ready to use. Okay, and this is very different. I'm not going to get into it, but I'm more than willing to if there are questions, but I'm not going to get into it right now. But down the pike, we are anticipating emergency use authorization of vaccines like the Johnson & Johnson one that just submitted authorization for the FDA yesterday. And so that is a DNA, vaccine. And then with the DNA, it is much more stable. So you can store it in the fridge. It's also only one dose compared to this, but there's other differences. So in terms of the development, really the big differences, because a lot of people are concerned, and it makes sense why people are concerned about the kind of the rushed timeline, the accelerated timeline. And the reason for that is because a lot of things up front were allowed to be done in tandem. There was a lot of incentives for the companies, to really throw all their resources in to take less risk, because we were, as a federal government and a country, internationally, we were helping to decrease the risk for these companies in terms of research and development and monetary risks and other things. And we meaning the FDA, et cetera, they eliminated a lot of the kind of the red tape, if you will. And then some of the companies did overlapping development of the phases, but they did all of the phases, phase 1, 2, and 3, which are the traditional clinical trials that are conducted before a vaccine is approved. The only difference is that currently they did not seek FDA approval yet. They only sought what's called FDA Emergency Use Authorization. And that's because it's a faster process. We are in an emergency, right? And time matters, right? Thousands of lives matter, and every, couple of days, weeks, et cetera, especially at the height of the pandemic, when these were seeked emergency use authorization in December, time does matter. So the FDA said, okay, instead of the usual 6 months of follow-up after a trial or a year follow-up, we're okay with only 2 months of follow-up. And that's okay, because we know that, for virtually every medication, vaccine, et cetera, everything that's going to happen in terms of side effects or things to be of concern about will happen right away, right? So that happened. The FDA looked at the data. It was very transparent in the process. The CDC and their Advisory Committee on Immunization Practices, which is this ACIP, they looked at the data, gave their recommendations as well, and they all kind of were okay with all of the safety data, and overwhelmingly okay, and they allowed it to go forward. And then what happened after that is we, in addition to that, in California, we joined with Oregon and Washington State, and we created a Western State Scientific Review Work Group. And we have 2 local San Diegan doctors who are on that work group who I know pretty well, and they're both excellent people. And they met with the industry, they looked at the data, they talked about it themselves, and they unanimously supported use of these vaccines in California, and as well as Oregon and Washington State. And then I want to talk about just phase 4. So for every vaccine, after the clinical trials, which is thousands and thousands of people, and in this case, in different continents and countries, there continues to be monitoring. And this is when you manufacture, right, and scale up the use of the vaccine, and then you continue to monitor, because now you're vaccinating millions of people instead of 30 or 40,000 people in the trial. So that's what you're seeing. This is just another way of talking about it, about the clinical trials, emergency use authorization, and the continuous monitoring. And I'm happy to pause if anyone wants. But the emergency use authorization, like I said, is a different process that really expedites the process, right? So this, as you see here, it may be issued by the FDA to allow access to critical medical products that may help during a public health emergency. So all of the tests that you see approved for COVID-19, all of the treatments have all gone through an emergency use authorization process. So it's not something specific to vaccines. That's everything right now is going through emergency use authorization. And then these are the criteria you see for an EUA, or emergency use authorization, to be issued. And it is still scientific. It is just, of course, allows for a quicker review, if you will. Okay. These are the 2 currently available vaccines, and one is called Pfizer-BioNTech, and one is Mrna, made by Mrna, and they both have things in common and a few differences, right? So they both require 2 shots. For Pfizer, it's at least 21 days apart. For Mrna, it's at least 28 days apart. The CDC says that you can wait up until 6 weeks, and but really you should try to get it as close to that time period that they're recommending that was in the trial, right? The 21 days or 28 days respectively, but you can wait up until 6 weeks, or if for whatever reason, due to low amounts of vaccine or whatever, don't be too concerned if you're a couple weeks later. If in the rare event, you're maybe at 7 weeks instead of 6 weeks, it's okay. The CDC says you do not need to restart or anything like that. So these are both injections in the upper arm, and then they were both issued the emergency use authorization in December, and they both are indicated only for adults, with the exception being that Pfizer goes down to 16 years of age, just because that's how they recruited in their trial, down to 16. They both are very effective, and we were all, I think much of the scientific medical community were very overwhelmingly ecstatic to see numbers this high, right? 95% effective based on large clinical studies. And you see here 43,000 and 30,000 participants. They had tried, unlike any trial before, to make sure that they have diverse participants in these trials. And it was very important to them, given the day and age that we are, to really get all types of people, race, ethnicity wise, age wise, with underlying medical conditions, etc. Okay, so, and then I just want to talk a little bit about how vaccine distribution works. You may hear on the news about phases and tiers, and what does that mean, right? So the broad phases are the categories, the broader categories, very general categories that are set by the federal level. And this is really, the CDC has an advisory committee on immunization practices, I mentioned it earlier, ACIP, and they recommend the phases to the CDC, and then the CDC director has to approve that. And they take into account things like the National Academy of Sciences had recommendations, et cetera. And really they're thinking through things like, what makes scientific sense, what makes implementation sense, and what is ethical and the right thing to do, right? So, and equitable as well. So once they, and I mentioned earlier, and what is equitable. So once they think through this, right, there's a lot of components in terms of thinking through a topic and a strategy that's as complex as equitable distribution of a rare or limited resource. So they do have to think about a lot of these things that you're seeing here, right? How to distribute something that's safe, inclusive, in a manner that's safe, inclusive, really allows for broad distribution and flexibility, because not one size doesn't fit all, and we're dealing with 50 different states, right, that have different capabilities in how they can distribute. And so then when you look at the phases, that's determined at the broader level. But so for example, 1A is just, as you see here, healthcare workers and long-term care residents, or hopefully you could see, you may not be, it's very tiny, I'm sorry. But that's the larger kind of phase. When California as a state, they have what's called the drafting guidelines work group, who then recommends further detailed guidance, essentially, and in what's called tiers, to the Community Vaccine Advisory Committee. So they get into more details so that way we can operationalize this, right? Because healthcare workers and long-term care residents is such a broad category, and so they then broke it down even further into 3 tiers for phase 1A, right? Currently, we are vaccinating everyone in phase 1A, which is all tiers of phase 1A. And then we are also have started to dip our toes into phase 1B, and particularly tier 1 of phase 1B, which is just the age-based criteria, 65 years and older, right? And you have to live or work in San Diego County, and you could be eligible if you are in one of those categories, right? And here you have pictures of our website, and we are always improving and really listening to that feedback and try to incorporate it as best as possible. We've made this more like our testing page, where you can see a map of the vaccine sites. You can put in your zip code and see what's closest to you. We have sites that we manage and we staff, and then we have partner sites where we work with different health systems or others really to vaccinate on our behalf, essentially, and they are vaccinating the public. Right. And this is different, for example, like Petco Park, where they're anyone can be eligible as long as you live or work in San Diego County. But even though it's staffed by UCSD, you don't have to be a UCSD patient, right? And that applies same to, we have a superstation that's staffed by Sharp, 2 superstations by Sharp actually, and then we have one up north, and then now UCSD is going to open up another one, and we're working with other systems to open up even more. So we are really building that infrastructure to vaccinate as many people as possible. And our goal is to vaccinate 70% of those eligible for vaccinations by July. And currently those eligible are those 16 and over, right? So now how do you know if it's your turn to get vaccinated? And this is what we recommend: going to myturn.ca.gov if you haven't already been vaccinated, and signing up for their notifications. You can put in your information, and based on your job and your age, it will tell you and will give you a reminder when you're eligible. If you are eligible, you can go ahead and schedule an appointment through there at some of our sites. Not all of our sites are yet using MyTurn. We are eventually going to try to go there as best as possible, but currently our staff sites are definitely using MyTurn. And I will say that for whatever reason, this website does not work well on Internet Explorer. So the state advises us to use Google Chrome or Safari or other things. Okay, so when it is your turn, what should you do and how should you prepare for vaccines? You want to go into it, right? It's like kind of going into a battle or going into a big test, right? You want to get as much rest as possible. You want to be calm. You want to have proper sleep, right? To make sure your immune system is as optimal as possible. Of course, you always want to eat healthy, but continue to. You don't want to do anything too crazy. You don't want to go drinking too much the night before. And you don't want to take any medicines like Tylenol or ibuprofen ahead of the vaccine because you heard that it might be good because you're going to get some side effects. It's actually not recommended by the CDC to take it in advance. You may take it later if you really need to, but it's not recommended before. Okay. So when you go, of course, all the protocols are still in place. Please distance and mask as best as possible. Obviously, when you're getting vaccinated, you won't be able to distance, but everything else you should be able to. So when you get there, they'll give you a card noting, well, actually first they'll register you and then they'll ask you a series of questions. And those series of questions will ask you if you have prior medical allergies or if you ever had certain kind of allergic reactions or other things like that, that may seem or may make you at higher risk for side effects. And just for that reason, even though side effects and these allergic reactions are extremely rare, which I'll talk about in a minute, we will monitor you for an extra 15 minutes. Okay, so everyone gets monitored for 15 minutes. So please expect to be there for 15 minutes. Bring your phone and bring your phone because then you can actually register for this application called vSafe. It's an after vaccination health checker, and they actually text you every day for the first few days to check in with you, and it's very easy to use, and they see how you're doing. If you had any, if you're feeling crummy, if you're not, if you had any side effects, anything of concern, if it's anything significant, someone will actually call you. They'll give you a reminder about your second dose, etc. So it's really good application. And the CDC just last week, they had another meeting and they already talked about some of the data coming out of that. This is a new thing. No other vaccine has had this, what's called active surveillance, right? It's just been that, okay, if something happens, you got to go back to your doctor. And then if they can, they'll report it. And most doctors will, of course, if it's serious. But this is an active, this is you talking directly to the CDC and really the CDC checking in on you every day. So this is great. I love this and I hope this continues. So after your vaccination, right, it'll take time for this to work throughout your body. If you are experiencing side effects, this is the vaccine working, right? And so they do require oh, sorry, I'll pause. Do you have to switch? Okay. All right, you're good. So sorry, they do require 2 shots for the vaccines to work best, and the vaccine takes about 2 weeks to really work in your body and for your immune system to respond fully to that vaccine, to that 1 dose. And then you have to get a second dose. And depending on which vaccine, you have to wait at least 21 days for Pfizer or 28 days for Mrna, right? And so continue to do everything that you're supposed to do, right? Wear the mask, all these small sacrifices that make a big difference in our community, really, in terms of distance and wearing a mask and washing your hands, staying home if you're sick, everything like that, avoiding large gatherings that help prevent the spread of coronavirus, right? With 1 dose, you get about 50, and some of the studies show about up to maybe 70% effectiveness, but really you need that second dose to get you to that 95%. So after the vaccine, they're just to talk about side effects. I hate the word side effects because these are expected effects. They're not side effects, right? We know that virtually everyone and the majority of people will get some pain in the injection site. They will get swelling, some soreness, right? So it's good to use your arm afterwards. Let that the good blood with the rich nutrients come in and get rid of the bad stuff. And then some people, and especially the older you are, the less likely actually you're to get these side effects. When the younger you are, the more likely. But some people will get more systemic effects. And these are things like fevers, body aches, chills, tiredness, headache. And this is things that you can, you should take it easy. If you're feeling feverish, if you're not feeling well, of course, stay home, plan ahead. Also, if when you're timing your vaccine, if you can, you want to stay dressed lightly, you want to be comfortable, right? Take care of yourself, stay home, of course, if you're not feeling well. And it should get better in the next 2-3 days, typically. If it tends to get worse or it doesn't go away after a few days, then definitely seek medical attention, call your doctor, etc. Okay. And then when you think about signs and symptoms that are due to the vaccination versus COVID-19, since both are, possibilities for some of the symptoms, it's important to make that distinction, right? So things that are unlikely to be from the vaccination are the things up here, right? If you have cough, shortness of breath, a runny nose, sore throat, loss of taste or smell, that is more likely to be COVID. The vaccine will not cause any of those. So that'll be COVID or something else, right? But it will not be the vaccine. It should be some sort of infection. And then for things that are common to both COVID vaccine and the infection or another infection are things, that are the other signs and symptoms. Those are some of the things I talked about, like your muscle aches, your fevers, your chills, etc. Okay. In terms of severe allergic reactions, these are called anaphylaxis. These are life-threatening severe reactions. And so the trials, even though they had 43,000 and 30,000 respectively, or more than that individuals, they actually did not see one case of severe allergic reaction. And that's because they only vaccinated that many people, right? Even though 73,000 is a lot of people, that's only 73,000. And so now that it's in the real world, so to speak, and we have millions of doses, not just in the US, but around the world, we're learning, we're able to see, are there other rare events that happen when you get the vaccine, or that can happen when you get the vaccine? And turns out that it is very rare, but it is possible to have these severe allergic reactions. And so, excuse me. So on the right in this table right here, you see that when you look at up until this reporting date of January 18th, this is data that the CDC presented at that meeting I mentioned last week, there was almost 10 million doses of Pfizer administered and over 7.5 million doses of Mrna administered, and they saw 50 and 21 respectively anaphylaxis cases, right? So this comes out to a rate of 5 per million doses, or 2.8 per million doses. So if you do the math, for example, for the top one, that means, as someone getting the Pfizer vaccine, you would have 1 in 200,000 chance of having a severe allergic reaction, right? That's very rare, and then even a lower chance, for example, with Mrna. And so really, what that means is that we have to be cognizant of the fact that it's rare, but it's not zero. And this is exactly why we screen and pre-screen before the vaccine, and why we make people at higher risk wait, and why we monitor you regardless for at least 15 minutes, and why all of our sites are equipped with the right equipment to handle these rare events, just in case they happen. Okay. And going back, sorry, you should not get either of the vaccines if you had any severe allergic reactions to the ingredients in mRNA vaccine, like I talked about earlier. So for example, there's polyethylene glycol, which is found if you've ever had a colonoscopy. You might have a prep called Go Lightly, if you were allergic to that, things like that. So, okay. And then the other reason really to get vaccines more than ever, really the relatively new reason, is these new variants of public health concern. So the viruses, they mutate all the time, right? We know, for example, the flu virus mutates often, and that's why there's a new vaccine every year to catch up, so to speak, with the flu virus. And just so you know, the flu vaccine is about 40 to 60% effective every year. And I was talking about these two COVID vaccines, which are about 95% effective, right? And in either situation, they're both the best public health tools we have, these vaccines. And these variants, though, are of concern because they all have one thing in common. Even though there have been mutations all along, these particular mutations have caused these variants to be more contagious. And when you're more contagious, then there's going to be more spread of the disease. There's going to be more spread means more hospitalizations and more ICU admissions. And that means another surge that we want to avoid if possible, right? We know that there is these variants in the US. There's a Denmark strain that has caused many outbreaks in Northern California. The Brazil strain, I believe, is in Minnesota at least. We know that South Carolina last week announced, literally a week ago from today, that they had 2 cases of the South African variant. And I will say that the South African variant, and now there's 3 cases in the US that are documented, that is probably the most concerning variant so far. It's concerning because there are data from all of the vaccines that they are less effective against that variant. That does not mean that they're not effective, and less effective of a very high, very effective vaccine is still very effective, or still effective, right? So that, as well as some of the antibody treatments as well, are a little less effective against the South African strain. In San Diego, we are doing a lot of surveillance. And please be assured that, we're nowhere at the level of the surveillance that they're doing in the United Kingdom, for example, in terms of genetic sequencing, but we are far ahead. We're doing way more surveillance than most states, and definitely most counties. And we have at least 139 cases that we are aware of the UK variant, or the B117 strain. So that is, we have definitely a reason to be concerned of the spread of the variants here. And really, this is just more reason that we need to get as many shots in arms as possible. Okay. And then really a reminder that we have to use all the tools we have, not just the vaccines, even though that is the best tool we have to really get back to normal, right? We want to minimize the spread, especially with these new strains, et cetera, of COVID, so that the virus has less chance to further mutate, right? If there's less virus, there's less chances to further mutate. And so you want to keep doing these small sacrifices that we've talked about a lot. And this is just I love this visual that every intervention is imperfect, right? Even the vaccines, they're 95% effective. They're not 100% effective, right? And so we know that we have to continue to layer on these imperfect interventions to get the best result. And that's it, Dominic. Oh, I'm sorry. I do have one more. How else can I help? And that's, really stay informed. Meetings like this, really thank you, UPAC and everyone. And then our website, please, you can help. Now that we've talked about this, now that you've hopefully learned and understand better, and I'm happy to answer questions, I please ask you to be trusted messengers within your families, your communities, and let people know what is not a myth, what is facts, so that they can make the most informed decision. And please help that messaging, like you can see here. And then these are other links, of course, where you can get more information. Okay. And these slides are, of course, freely available to share.
Wow, thank you so much, Dr. Sayone. That was a very thorough presentation. You clearly know your stuff when it comes to the vaccines. Really appreciate your explanations of everything too. For example, I myself was curious about the difference between DNA and RNA, and why is it that you can't get COVID from the vaccine? So thank you for explaining that. I see that there are a few questions in the Q&A box on this Zoom window. The first one says, what determines when we move to the next tier? Like vaccine eligibility tier, I'm assuming.
Okay, I was just gonna say, because there's 2 different tiers, unfortunately. There's a purple tier that we are in terms of the cases, and then there's also the vaccine tier. So I'll answer for the vaccine tier, but 8T, if you want to clarify, and if I'm answering the wrong question, just let us know. But in terms of the vaccine tiers, it's both supply and demand, really, right? It's really supply and demand. When I say that, I mean, it depends. If we have enough vaccine and we're able to, for example, get to enough 65 and older individuals, and we're continuing to allow 1A, of course, individuals to get vaccinated, even though they're pretty much done. We're really dealing with the older adults at this point. once we start seeing, appointments dry up and appointments open up, where there are appointments that are not being scheduled or taken advantage of, then we will know that there's more supply than the demand, and then we will go on to the next rest of tier 1 in phase 1B. And so the rest of tier 1 in phase 1B is your emergency service workers, your teachers, your childcare staff, your food and agriculture staff. Do you want me to go to the next one, Dominic?
Sure. If you can also see it, go ahead. Thank you.
Yeah, of course. Yeah. So what do you do if you get COVID after getting the vaccination? So that absolutely can happen. And there are several cases of documented cases of it happening, across the country, then definitely. And I've heard stories of that happening locally as well. So, it, like I said, statistically can happen because you're not fully protected for 2 weeks after you get the vaccine, and one dose will not give you that 95% effectiveness. You really won't get that until 2 weeks after your second dose. And and even if you get both doses, you're still 95, not 100, right? So for many reasons, you could still get COVID. So if you get COVID between your first and second dose, then the CDC says that you cannot get your second dose while you're infectious and contagious, of course. So for most people, that's 10 days, and then with no fevers and improving symptoms. For some people who are hospitalized, it can be, or severely immunocompromised, it can be up to 20 days. But then you can choose to get it after the 10 days or delay it for months. And it's totally reasonable to delay it for a few months because you already have some immunity built up from getting the virus itself, in addition to that first dose. And then the third question, how much longer do you think we'll have to deal with this pandemic? I think that's the magic question, right? The $4 million question, maybe $4 billion. It's so important. And really, if it wasn't for these new variants of concern, I think that many of us would be much, much more optimistic in terms of, we just need to now get in the vaccine in arms. And then as soon as we do that, we'll see the rates drop. It's not necessarily a light switch. It's more of a dimmer, right? Where you'll see the rates of COVID drop, or you'll see the hospitalizations drop and the deaths drop. And to a point where then we don't have to be asked to make all these extra sacrifices, right? Like staying at home or not having gatherings, etc. And then we'll drop into the other tiers. We'll drop into the red tier, the orange tier, the yellow tier, and be allowed to do additional things. So hopefully we'll continue to see the case rates drop. We have gotten over that surge, that hump, or if you will, of that last surge, and we are seeing the case rates, hospitalizations, ICU admissions drop, and that those are all good signs. The concern is that these new variants, and specifically the B.1.1.7 variant in San Diego, is expected to increase, and it looks like it is increasing in circulation as we're monitoring, and we are expecting some sort of surge from that. And that's why we need to get as many vaccines in arms, although admittingly, there is limited vaccine to go around. So I don't have an exact answer. I would love to say the summer, but I also want to acknowledge that we don't, not even everyone can get vaccines now, right? Especially children. Currently, there are trials going on for kind of more of the teenager ages, and there are still no trials for anyone under 12 that I'm aware of. And so we are, those trials have to go on. The FDA has to expand the age range, and then we have to get those individuals vaccinated. So there is definitely a process, but definitely hope to see cases continue to go down and hopefully stay down if we all take our precautions as seriously as hopefully we continue to do.
Thank you, Dr. Sayan. I'm seeing in the chat over here another question. What kind of research have you found wherein marijuana helps the symptoms of COVID-19?
I have not seen, and I'm sorry, because I do definitely look at, my job is to look at a lot of the research, right, and understand and etc. But I have not seen anything come across my desk, at least about marijuana. I haven't seen anything in the CDC recommendations or the guidelines around marijuana, about helping the symptoms of COVID-19. I apologize. That doesn't mean that it's not out there. I'm just saying I am not aware.
Okay, so I'm not seeing any questions posed through the Facebook comments yet, but viewers, feel free to type them in as you think of them. And I also just wanted to share that the program that UPAC has for COVID communication and outreach is going to be trained very soon in the coming days on hopefully helping folks with making appointments for their vaccination for COVID-19 and maybe even getting an allotment of appointments reserved for folks because I know that a lot of people have been having trouble with getting their appointment, right? They want it, but the internet is posing a lot of obstacles for people. Um, and that's not even including, language barriers and other things. So, uh,
You're
Dr. Sa-
absolutely
like
right.
to and maybe also, if you want to segue into health equity too, I know that you are very interested in that, as am I.
Absolutely. So I wanted to say that really tying the equity and then this work, right? We know that equity, there's many lenses and ways you can look at equity, right? Even when we look at those who are eligible currently and the older adults, right? They have been disproportionately affected from a medical standpoint in terms of hospitalizations, deaths, etc., and social isolation, right? Being asked to stay home and seeing a lot of their friends, family, colleagues of their age group passing away versus younger age groups. I'm going to pick on you, Dominic, people, young adults who, not you necessarily, I'm obviously joking, but folks who are in their 20s and 30s actually have the highest rates of coronavirus. And people don't realize that if you're young and you have the highest rates of COVID-19, that doesn't mean that you should not get vaccinated. That's actually more reason to get vaccinated, because even if you're less likely to get hospitalized or die, that does not mean that you are not likely, right? It's not a zero chance. We just announced today our first pediatric death of a 10-year-old from COVID-19. That's extremely sad. And before that, we had a 19-year-old maybe a month ago. And so it's then, and dying is the ultimate worst outcome, but there's a lot of suffering in between. There are people who still get hospitalized who are younger adults. There are people who don't get hospitalized and suffer from COVID, really have symptoms, right? And some people, and this is not talked about enough, but some people have these long-term inconvenient symptoms from COVID-19, things like continued loss of taste and smell, continued high fevers, etc. And so why even put yourself through that when the safest way to build that immunity is through the vaccine instead of rolling the dice to see if you just get COVID? And then also, not only you're protecting yourself, but really a lot of the young individuals who get COVID are the reason and are the way that COVID ends up going to older adults or more vulnerable people, more vulnerable parts of the community, right? Based on just who you live with, who you socialize with, and where you work. And so this is it's very, very important, and more reason why really young adults should consider vaccination as much as older adults. But back to your original question, Dominic, sorry, is that yes, currently, we know that it's not easy to get an appointment. We acknowledge fully that it's a struggle for many people, especially those who cannot speak English, who do not have computers, etc. 211 San Diego, you can call them if you're 75 and older, or if you're with someone who's 75 and older, and they can actually help make the appointment for someone who's 75 and older. As capacity expands, they might be going down to 65, but that is not confirmed yet, and likely, hopefully, we're hoping it'll happen next week as more and more 75-year-olds are getting vaccinated. And in addition, what you mentioned, Dominic, is so important, right? We partner with UPAC and many other organizations for good reason. We learned very early on that our message was not getting to everyone. We learned that not everyone was testing who should be. We learned that people had symptoms, but we're not testing. We know that culturally there's a lot of differences. Families like mine, and I'm South Asian, I'm Sri Lankan, right? We like to have big gatherings. We like to all get together. We like to be close in close quarters, et cetera, and multi-generational families. And some families and cultures are just by definition more predisposed to spread of COVID-19 to vulnerable people. So we knew that we had to partner with extenders, if you will, with really allies that would extend the message and the facts so that in a way, and in their own way, in a way that works and actually is effectively communicating to stakeholders, their populations, because otherwise they wouldn't hear it, or they might not receive that information from us. Not everyone likes hearing from the government, and that's okay. And that's why we have a lot of trusted partners. And for vaccination equity, I did want to say that we have a dashboard. We have data that's updated daily, and it shows the regions of the county, the age groups, the gender, as well as the race ethnicity breakdown. And you will see that there is some incomplete information, like 13 to 14%, I believe, of race ethnicity is missing. But relatively speaking, believe it or not, a report from CDC this week came out saying that of all national data, about half of the race ethnicity data was missing. So we're definitely doing better than the country as a whole, but there's still a lot of room for improvement. Okay, Dom. Sorry.
Yes to all of that. Also, thank goodness for the COVID response teams, such as the Pacific Islander one. I know they're coordinating nationally, and it's really great to see communities coming together to solve problems in the way that they know would be best. So, yes, thank you for saying everything you did. In the Facebook comments, I'm seeing another question. When do you think these age groups, 20 to 30-year-olds, can get their vaccine?
So it depends on a couple of factors, right? So currently 20 to 30-year-olds, right? If you're eligible because of your job, you can be eligible way before you're eligible because of your age. Meaning if you were a healthcare worker, right? If you were a 20-year-old nursing assistant, for example, right? You were already eligible. And then after we get done with 65, or get far enough with 65 and older, that we have the capacity and the ability to expand and extend down to and start including these other essential workers, starting with police, emergency services, which includes law enforcement, but not only law enforcement, as well as education, all those. So if you are, for example, 20 or 30 years old, and you're in one of those groups, if you're a restaurant worker in food and agriculture, if you're a childcare worker, then you will be eligible then, right? But purely, if the question is purely based on age, the reason I say it depends is because the state said last week in a press release that after we finish with phase 1B, tier 1, if we are still very limited on vaccine, the state may consider changing to an age-based model, or at least highly significant age-based model. We are waiting on details of that. We don't really know what that means. There's implications, of course, for things like equity, et cetera. And, if we do it, and it depends all in how it's rolled out and what the details are, really, like everything, right? The devil's in the details. If we did not do that, and we stuck with the phases and tiers as is, then phase 1B tier 2 would be a whole bunch of other essential workers, congregate settings, and then phase 1C would go down to 50 years old, and then it would be 16 to 49 years old with medical conditions or underlying conditions that predispose someone to severe versions of COVID if they got COVID-19. So phase 1C would be then when we would go down essentially to 16 with underlying medical conditions. But if you were a 20-year-old with no medical conditions and you were not an essential worker, and I hate the word essential worker, but a worker that's defined as an essential worker by the state or federal government, then you would have to wait till phase 2. I have no idea, I can't give a prediction on when that actually will happen, but that's the timing. So hopefully that gives you a better sense. But again, it depends on multiple factors, as you heard.
Thank you. Thank you. Yes. Okay, so we're running a little close to our end time. I wanted to make sure we have enough time to do a raffle for the people who registered for our event tonight. We have a fancy schmancy UV light sanitizing box for your small items such as cell phones, keys, that we will happily mail to the winner tonight. And so, Ate Jeanette, do you have our wheel of destiny ready?
Okay, I will make it ready. So, okay, so we have art, we have Agnes, we have Jeanette, and who else with you? This is the only person that I can see from here.
We have Rique, Rique,
Hold on. RIQUE. Okay. Rocket.
Are you able to screen share?
Oh yeah. Hold on. Sorry. Okay.
And while you are getting that ready, I also wanted to mention that our program website for more information and how to contact us is UPACSD, so UPACSD .com/programs/CHWCOS. We're very open to emails, calls, texts. We can help you in person. We can distribute flyers and hygiene supplies. We also have blood pressure monitors. So feel free to contact us, and we are happy to connect you with resources and more COVID information.
Okay, we're ready.
I should have registered.
Yay, Rique! You're the winner.
Yeah.
Congratulations. So we'll connect after this, and I will get you your new sanitizer box. So thank you everyone as well for helping put on this event. Thank you to the viewers and the attendees, and for all of us in the community who are doing our best every day to hang in there, and help others. Um, Please remember to also take care of yourself and pat yourself on the back. This isn't easy for everyone, but together we can really have a brighter future. So tune in next time. Our session is on February 17th, and hope to see you soon. And thank you again, Dr. Sayon.
My pleasure. Thank you all for
Thank
being
you, Dr.
trusted messengers.
Sayon.
Thank you.
Bye.
Bye.
Thank you all.